Hey all, welcome back. So if you're done with EMREE and the application, the next step on the process is MMI. MMI is multiple mini interviews. So to make the best out of it, you have to put in some preparation. So let's get started with it today. MMI is unlike the typical question and answer because they are not expecting the right answer from you. They are expecting your judgment and your reasoning. It is mainly testing your ethics, your communication skills, and problem solving skills. There are no memorized answers, but you need structured thinking and clear communication. So practicing beforehand will really help. There are two tips for answering the MMI questions. So there can be different types of questions like role play, like ethical dilemma, and breaking the bad news and all those things. So you can use the STAR method, which is called the situation, task, action, result, and reflection, to structure the responses. And you always have to practice under timed conditions because it's not how well you can talk, it's how well you can do in a very stressful situation, because your real life work situation is mostly going to be stressful. So we'll dig in deep about what MMI is and how the format is going to be, what is expected out of us, and all those things. So MMI can test different skills. Like I told you, ethical dilemmas, example regarding the patient confidentiality, and if it is, contrasting with the public health aspect, like for example, if the patient is HIV positive and they don't want it to be disclosed to their employer, but that is again public health aspect. So you have to frame your answer based on that. It can test your communication skills, like breaking the bad news. It can test your critical thinking aspect, like prioritizing emergencies, like your triaging. Which patient will you treat first, like that kind of situation. And it can assess the role playing, like calming an anxious patient. Now, in order to prepare, you have to prepare in a timed scenario. You can talk with the mirror, or you can find some partner who you can spend time to actually prepare for the exam. Actually get 1 to 2 minutes to prepare and 5 to 8 minutes to respond. So it's like a 10-minute situation. So you have to first frame your answer in your head. You have to make the outline of what you're going to say, and that outline is what we have talked about, the STAR method. So in the STAR method, there is the situation, task, action, result, and reflection. So situation means you're describing the scenario. Task is you're explaining your role. Action is what steps did you take from your part, and result is what happened, and reflection is what you did learn. So we'll do that with an example. Okay, so suppose the question is, a junior doctor accidentally prescribes the wrong medication to a patient. The patient has already taken the medication. What would you do? Okay, so this is the question. So there is some medical error. So there is an ethical thing, prescribing the wrong medication, because the first thing in the ethical principles is to do no harm, okay, non-maleficence. So we have breached that. Now there should be transparency between the patient and the doctor. So we have to communicate that effectively. So there are so many things happening in this situation. So in the STAR method, what is the situation? So as I'm answering the question, I'll say, as medical professional, patient safety is a top priority. In this case, a junior doctor has prescribed the wrong medication and the patient has already taken it. So I've took my stand and I've just mentioned the situation. So this is the situation now. Now explain your task, define your role. My responsibility is to ensure that the patient's well-being, address the error, and take steps to prevent further harm. So I have took my task and I have defined my role. My responsibility is first to ensure patient's well-being. You have to address the error and communicate and take further steps to prevent the harm. Like this should not happen again. So you have to take steps for that as well. Now next in the STAR method is your action. So explain what would you do in that situation. So you have to first, always it is patient centric. Our approach should be patient centric. So first assess the patient for any immediate adverse effect and inform the senior doctor. So I have communicated with the doctor chain and then I have to communicate with the patient bystanders. Next, I'd report the incident to the hospital patient safety team while ensuring the patient is monitored and supported. Transparency is crucial, so I'd communicate openly with the patient and their family, explaining what happened and what steps we are taking to manage the situation. So this can be, there can be a blurting of emotions, from the bystander side. There can be, they might not take it, very lightly. So you have to communicate very effectively, telling that this has happened, but we are managing that situation and the patient is stable. So you have to first make sure that the patient is stable. You have to communicate to the authority, to the drug safety team and all, and to the patient bystanders. Next in the STAR method is the result. So share the outcome. So you can say that by responding quickly and taking accountability, the patient would receive proper care and we would minimize harm. Reporting the error would also help improve protocols to prevent future mistakes. Okay, because that becomes our next concern. We don't want this mistake to be repeated again. So we will improve the protocols. We'll make sure that every time a drug is given to the patient, we confirm the patient identity, we confirm the drug, we confirm the route. Okay, because there is always a closed loop communication. So if you ask a nurse to give a drug, the nurse has to talk back to you. Okay, I'm giving this drug, this dose through this route. Especially in ACLS and all, we have learned that closed loop communication. Okay, next in the STAR method is reflection. That is, you have to show your personal and professional growth. What have you taken from this incident? So this situation highlights the importance of clear communication, teamwork, and non-punitive approach to medical errors. Learning from mistakes and promoting a culture of patient safety is crucial in healthcare. Now, this is a very written format. I don't want you to, we don't want to be talking like a machine. We can talk in our own tone and the conversational tone, but this is how it should be. So we'll look at the question again. We'll practice again. So a junior doctor accidentally prescribes the wrong medication to a patient. The patient has already taken the medication. What would you do? So we'll say, I'll not break down the STAR again. You have to think it in mind. This situation, task, action, result, and reflection. So as a medical professional, patient safety is a top priority. So in this case, the junior doctor has given the wrong drug to the patient and the patient has already taken it. So my top priority will be to analyze and assess the patient, ensuring patient is okay and stable. I have to communicate that to the senior doctor, to the authority, and to the patient bystander. So that will be what I'll be doing, and I'll also make sure that the patient is being assessed during the time and rule out any immediate adverse reactions. So by responding quickly, we have effectively managed the situation with clear communication. We have created transparency in the situation, and we have also talked with the authority and taken protocols to ensure that this mistake will not be repeated again. So in this situation, I have realized that clear communication and a teamwork is very, very crucial for the betterment of patient. Okay, so that was one of the method of answering your MMI. So during your MMI, you always have to stay professional and calm. You have to clearly communicate your ideas, and while preparing, you can get feedback from your peers. You can always join mock MMI sessions and practice. So if anybody is willing to practice with me so that we can put it on YouTube, you can reach out. through the comment section or through the mail. And I'll put more MMI videos on the structured formats and example questions. There is a website called BEMO, BEMO, which has hundreds of MMI sample questions. Some has structured answers to it and some are just questions, so you can prepare among yourself using these methods. There are more methods which I'll talk about in the next video.